Hi, everyone. Thank you for joining me today to talk about a project called Resources and Tools to Reduce Multiple Risky Driving Behaviors. This is a project that's sponsored by the Traffic Safety Culture Pooled Fund. We're going to be recording this webinar, and it will be available on our YouTube channel. I think everybody is pretty familiar with WebEx, but just in case, you can either join by computer or by phone, and you can click on those three vertical dots at the bottom of the screen to connect to the audio. We're going to be using the chat function today for today's webinar. If you have any questions, please feel free to use that chat box to send those questions. We're going to have Kelly Green and Bridget Hanson, both will monitor the chat function. And then if you'd like to ask a question verbally, Kelly can also unmute you if you'd like to do it that way. So please send those questions when you're sending them both to the panelists and to the host, and then we'll be monitoring that chat, and then we'll make sure at the end of the presentation that we have time to answer those questions. So we are the Center for Health and Safety Culture, and we're an interdisciplinary center that conducts research on how culture impacts health and safety. I'm Dr. Carrie Finley. I'm the principal investigator for this project, so I'm super excited to talk about it today. I'm also joined by my colleagues, Dr. Bridget Hanson and Kelly Green, who were both very instrumental throughout this project, and so they're here with me, joined with me to answer questions and to work through or talk about any parts of the project. So we're an interdisciplinary center, like I said. We do applied research. We conduct applied research all in partnerships with communities, state, tribal, and national organizations who are looking to improve health and safety. All of our research is applied with folks who are really trying to make a difference in their communities. Our work covers a lot of different issues, but predominantly these four. Together, these issues have a big impact on public health. They really are the leading causes of years of potential life loss, and they overlap. So we know that the misuse of substances, for example, has a big impact on traffic safety. And likewise, violence and child maltreatment are impacted by substance use, and all of these are interconnected. At the federal and state and community levels, these issues are addressed in a lot of different ways. And it's really interesting to see how departments of transportation, for example, approach behavior change and health and safety, and compare that to efforts to reduce underage drinking or domestic violence. Working in all of these different domains is really insightful for us, and our big picture goal is to really step back and look at an overall approach that can transcend these issues. Like I had mentioned, this project was sponsored by the Traffic Safety Culture Pooled Fund, which is a national research group focused on creating tools that positively promote and change culture. This Traffic Safety Culture Pooled Fund started together in 2015 and has done some really amazing work to advance the research on traffic safety culture. I invite you to learn more about this pooled fund by visiting the Montana Department of Transportation's website. And this Traffic Safety Culture Pooled Fund is just getting ready, actually, to launch another phase of the pooled fund. And they are in the process right now of seeking additional partners. So if you're interested in getting involved or learning more about this research on traffic safety culture, please do visit MDT's, Montana Department of Transportation's website. As the principal investigator for this project, I am excited to share with you what we learned and what we created to help traffic safety stakeholders think about addressing multiple risky driving behaviors together to improve overall driving safety. So we're going to start with an overview of the project and our goals for engaging in this project. We're going to talk briefly about what we learned in a review of literature, We'll talk about a brief intervention that we created to reduce multiple risky driving behaviors amongst college students. And then we'll share the findings from a randomized control trial. And then finally, we'll talk about recommendations and guidance based on what we learned in this project that can help traffic safety stakeholders think about ways to address multiple risky driving behaviors together. I know that you are all busy and it takes time out of your day to join a webinar like this, so thank you for your willingness to join and learn so that we can share the information that we learned in hopes to help you impact traffic safety in your communities. So let's start with an overview of the project. We know that drivers who are involved in fatal crashes and serious injuries are often engaged in multiple risky behaviors: not wearing a seatbelt, speeding, driving impaired, driving distracted. The need to address risky, so we know that those who are involved in fatal crashes are often involved in multiple risky driving behaviors. And it was recognized by the Traffic Safety Culture Pooled Fund members that to help us collectively reach our goals of 0 deaths on our nation's roadways, that we would need to dive in and understand factors that influence multiple risky driving behaviors. We wanted to explore interventions that were out there in the literature already, but also that things that, interventions that could be developed to address multiple risky driving behaviors in a way that was collective versus looking at risky driving behaviors in a more siloed way. It was also recognized that those who engage in multiple risky driving behaviors might need more intense or different interventions than are typically provided to drivers, who are cited for just one risky behavior in isolation. When we started diving into the research, it was clear that the research evidence suggested that there are different associations, between multiple risky driving behaviors. And researchers were absolutely making recommendations to address these risky behaviors in combination because the behaviors have some similar underlying belief systems. So this led us to create a project to understand what those factors and associations are that go across risky driving behaviors, to develop and test a brief intervention that would reduce multiple risky driving behaviors, and then to take what we learned from that to create guidance and recommendations so that traffic safety stakeholders and others could really start to think about how they can integrate what they're learning and what we're learning from this project into their work, and they could apply it to their work to address multiple risky driving. So we started with a review of the literature to understand really what was out there in the published research. We knew, for example, that impulsivity was a factor that was associated with multiple risky driving. And so we wanted to dive in and look specifically at that construct. We also knew that impulsivity wasn't the only factor that was influencing multiple risky behaviors. So we explored a variety of other factors too. We looked at cognitive factors and affective factors, motivational factors, and contextual factors that all were associated with multiple risky driving behaviors. In the literature review, we also explored interventions and strategies that were already in the literature to reduce these factors, like what was out there already to reduce impulsivity and these other factors, so that information could ultimately inform the development of an intervention to reduce multiple risky driving behaviors amongst college students. So one of the first factors that we really did explore was impulsivity. Impulsivity is broadly viewed as this inability to withhold or stop a response in the face of negative consequences, where a person prefers really a small immediate reward versus a larger but delayed one, and acting without forethought before all the necessary information is available to them. Impulsivity is really characterized by that tendency towards quick and unplanned reactions without considering the consequences. Impulsivity has been widely studied and includes a lot of different dimensions of behavior. Impulsivity has also been studied to understand behaviors in different contexts and in a driving context. Impulsivity in the driving context has been referred to as has been termed traffic impulsivity. And traffic impulsivity is really defined as that tendency to act quickly and inaccurately, or act quickly and accurately, but without considering the consequences or elaborating on the future consequences. Specifically, it might involve things like the inability to wait in traffic, or expressing anger and aggression to others while driving, speeding, using a phone, following too closely, making sudden maneuvers without considering the consequences, acting impulsively. Researchers have commonly agreed that impulsivity is a personality construct that's associated with high-risk driving behaviors. So it has been studied in relationship to behaviors like speeding and following too closely and driving while impaired. And it's associated with negative outcomes associated with those high-risk driving behaviors like anger and aggression, driving under the influence of alcohol. It's been associated with traffic crashes and with traffic violations. Drivers who are categorized as having more risky driving behaviors often score higher on impulsive behaviors than those who are categorized as having more safe driving behaviors. But the good news is that impulsivity is a trait that is changeable, that can change, and it's a trait that overlaps and is associated with other factors that affect risky driving. So when we started to think about an intervention that was designed to reduce multiple risky driving behaviors, we knew that we wanted to focus on impulsivity. Our review of the literature included, like I mentioned, other factors as well that were associated with multiple risky driving. For example, we looked at cognitive factors like sensation seeking and risk perceptions. We looked at some affective factors like anger and aggression and personality factors. We also looked at motivational factors like a person's tolerance to engage in deviant acts or their reward sensitivity. We also looked at contextual factors that were associated with multiple risky driving. For example, we looked at demographic variables. The characteristics of high-risk drivers are really well defined, and they include groups of drivers who are often young, inexperienced, and have higher crash rates than others. Younger drivers that have less experience at the driving task and perceive less risk in engaging in risky driving behaviors. Males are more likely than females to engage in risky driving behaviors. And while some of those factors, age and gender, aren't modifiable factors, when we were developing an intervention to reduce multiple risky driving behaviors, we wanted to really think about strategies that could reach these demographics and keeping those in mind as we were creating an intervention. We also looked at substance use behaviors and psychological reactance. For example, driving under the influence of substances is associated with multiple risky driving behaviors like speeding or riding with someone who's been drinking alcohol and aggressive driving. There's also an established research that shows connections between impulsivity and problematic substance use and multiple risky driving behaviors. One of the big takeaways, I think, from the literature was that there are different factors that affect risky driving, and that we want to think about those in combination because they overlap and they're related to one another. And we knew from the literature that an intervention that was going to address multiple risky driving behaviors would need to consider the influence of these factors, these underlying factors. We would need to understand how they overlap and how they influence one another. So once we reviewed the various factors associated with multiple risky driving, we wanted to clearly be able to see how those factors, like what those factors were and what risky driving behaviors they were associated with. This is a chart, just a visual representation that shows the various factors along the left column that they're associated with. So this chart shows the various factors and then the risky driving behaviors across the top. And so we can start to see how they overlap, the research evidence that's out there, and how we could use that information then to inform our design of a brief intervention. If you're interested in learning more about what we found in the literature review in more detail, you can go to Montana Department of Transportation's project website, the Traffic Safety Culture project page. It will take you to our final report on this project, which will be posted soon, and it might already have been. I didn't check right before this, but our final report on this project and all of the resources and tools will be posted there as well. So in addition to understanding the factors, those underlying factors associated with multiple risky driving, we also wanted to understand strategies to reduce risky driving behaviors, to reduce impulsivity, and some of those other factors that were associated with risky driving. So we looked at strategies to reduce speed and impaired driving, seatbelt use, distracted driving. We looked at strategies to reduce impulsivity and risk perceptions, and strategies that could modify some of those factors that are linked to personality and psychological factors to the target behaviors. So for example, attitudes are often found to be mediators, and driver attitudes are related to high-risk behaviors like speeding. Attitudes are a strong predictor of intention to engage in driving violations like impaired driving or distracted driving. We learned that interventions that target driver attitudes, for example, is a strategy to reduce risky driving behaviors, and that we wanted to think about that when we were looking at our intervention. So once we took a deep dive into the literature, we were ready then to develop a brief intervention to reduce multiple risky driving behaviors. So our goal in creating a brief intervention was to reduce multiple risky driving behaviors and to avoid those harmful consequences as a result. In our design of that brief intervention, we really intentionally thought about how do we meet people where they are in the process of behavior change. We wanted to explore cognitions that were related to multiple risky driving. We also wanted to provide strategies, behavioral strategies that could increase safe driving behaviors. And we wanted to use strategies that would grow a person's motivation for change. So those were kind of like our foundational goals in creating the brief intervention. And we used a strong theoretical foundation for the brief intervention. We wanted to design an intervention that could be virtual, and it could be completed in a really short amount of time. So we really stuck with like, what could we do that would be virtual and brief? We really thought about that 5 to 10 minute time frame. And we wanted to use some of the technology that we knew was out there and available to us. So we wanted to use text messages in the intervention to support the behavior change. We learned in studying other interventions that had been successful that text messages could be a delivery method that could reach a wide range of people in a really convenient way and in a cost-effective way. We used a computer program called SciUS, which is a computerized intervention authoring system. It's an open source resource that's funded by the National Institutes of Health and through an award to Michigan State University. So we used this SciUS as the delivery for the brief intervention. It really is, SciUS is a platform that supports digital behavioral health interventions. And so that was the platform we decided to use. It also is a platform that includes animated narration, and it can support, various audio features. It can make it more interactive, the experience to be more interactive. So that was our decision-making in selecting SciUS as that platform. For the brief intervention, we ultimately created a personalized intervention based on risky driving behaviors that were indicated by the participants. The brief intervention was designed so that all the participants completed an emotion session that focused on identifying and regulating emotions, which is a strategy that seeks to reduce impulsivity. And then those skills of identifying and regulating emotions were carried into very specific behavior sessions. The brief intervention targeted specific factors that were associated with multiple risky driving. Things like our brief intervention targeted impulsivity. It targeted risk perceptions and attitudes and beliefs that were associated with risky driving. And the sessions were designed to provide education. They were designed to heighten risk awareness, and they were designed to provide personalized feedback based on the assessment that participants took on the multiple risky driving behaviors and beliefs that those participants had. The intervention also provided normative data about the risky behavior and offered strategies that participants could select from and that were really tailored to their motivation and their readiness to make a change. And then further, like I mentioned, we also use text messages as a way to support motivation and commitment to change and to bolster those protective beliefs that were identified in the brief intervention. It also encouraged, the text messages also were used to encourage participants to practice identifying and regulating their emotions and to practice the strategies that they've selected in the intervention. So once we created the brief intervention, we did some pilot testing. We pilot tested the assessment and the brief intervention, and then we made adjustments based on what we learned from that pilot testing before we rolled out the intervention and the randomized control trial on a larger scale. So now I want to talk about what we learned from the randomized control trial that was really designed to test the efficacy of the brief intervention to decrease multiple risky driving behaviors amongst college students. The outcomes of interest we looked at speeding, driving under the influence, seatbelt use, and distracted driving. So the participants in the study for the randomized control trial were recruited through direct email. And to be eligible for the study, participants had to be between the ages of 18 and 25. They had to have a valid driver's license. They had to report driving at least once a week and report engaging in at least 2 risky driving behaviors in the past month. So before we started the randomized controlled trial, we conducted a power analysis to see just how many participants we would need to have in our sample to be able to detect an effect. And in our preliminary power analysis, we determined that we would need a final sample of 172 participants to detect a small to moderate effect. Now, we did anticipate some attrition, and so we started out knowing that we would need to over-recruit participants into the study to ensure that we had an adequate final sample size. Our goal when we started the randomized controlled trial was to recruit 350 participants with the hopes of, through attrition, making sure that we had that final sample size of 172 participants in the study. We did not realize how difficult or challenging recruitment would be. We ended up launching our first cohort in April of 2023, and our initial plan was to only have one cohort in the study. We used a variety of different recruitment methods. We used 4 recruitment emails, and we ended up having 362 participants take our initial screening questions. And of those 362, 99 participants did screen in and provided their email addresses to us, and they were assigned to one of the conditions, either control or intervention. Of those 99 people, only 22 completed the baseline survey, and only 9 completed the final follow-up survey. We knew that this was not enough, and so we revised our recruitment strategy. We increased the incentive amounts with the pooled fund members' approval, and we decided to launch a second cohort in hopes to increase participation in the study. In cohort 2 launched in October of 2023. And in cohort 2, we had 587 participants take the screening survey, and 358 screened in and provided their email address to participate in the study. The eligible participants were then randomly assigned to either the control group or the intervention group. All the participants were asked to complete measures at 3 time points, at baseline and post-intervention, which was immediately following the intervention for intervention participants, and then that same delay for baseline for control participants. And then we also asked them to complete a follow-up survey, which was 3 months following the post-intervention, following their completion of the brief intervention. This is a timeline for the randomized controlled trial. And ideally, we would have had every participant in the intervention group would have completed every session and every measure at the approximately same and scheduled time. However, in reality, we knew that that wouldn't happen, but our goal was really to retain as many participants in the study as possible. We sent a variety of reminder messages through email and text messages to participants who were not responsive to each of those sessions' kind of generalized timeframes. We also incentivized participation throughout the study using Amazon gift cards. In total, we had 43 participants complete the baseline survey in at least one of the subsequent surveys, either the post-test or the 3-month follow-up. 17 participants were randomized to the control group, and we had 26 who were randomized into the intervention group. The intervention participants were assigned then to address 2 risky driving behaviors: speeding, distracted driving, not wearing a seatbelt, and driving under the influence. And whichever 2 behaviors they endorsed in that order were the sessions that they were assigned to participate in. Analysis of the survey responses in more detail can be found in our final report. For example, we did baseline descriptive statistics and correlations for each of the variables, and those are all in the final report. But for today, we're talking about, we conducted a repeated measure MANOVA to test the effects of time, so the baseline, the post-survey, and the follow-up survey, and by the condition, either the intervention or control, on each of the dependent variables of the risky driving behavior, risk perceptions, control beliefs, normative beliefs, impulsivity, and emotional intelligence. Quantitative results showed no significant differences were found between the intervention and control participants in the risky driving behaviors. And this is likely due to having a really small sample size and inadequate power. We weren't able to get to that 172 participants that we had hoped in order to be able to detect a small to moderate effect. And like I mentioned, we knew that going in that we were really trying to keep participants in the study so that we would have those participants could be able to detect any changes between the intervention and control group. And after recruiting for cohort 1 and launching that cohort 2, we still did not meet our goal of 172 participants. Qualitative data did suggest, however, we did collect not only quantitative data, but also qualitative data. And qualitative data did suggest that participants learned relevant information and they did apply that information to their driving. At the 3-month follow-up, intervention participants provided feedback to us about their experience. With a scale from 1, which was strongly disagree, to 5, strongly agree, participants were asked to the extent to which they agreed or disagreed with a variety of different statements. And most participants reported positive experiences, including having learned, relevant information, and they applied that information to their driving. Participants were also asked to describe how their driving had changed, and they described a number of things, but many participants described being more aware and attentive while they drove. Some participants also described improvements in emotion regulation, and some described specific changes in their driving behavior. Some of the participants also made comments that reflected a better understanding of risk. These are just a variety of different example quotes that reflect some of those changes that participants described. The brief intervention that we created was intentionally designed to offer participants a variety of different strategies that they could select from and utilize during the intervention. And strategies for each of the behaviors in the intervention included both what we called traditional strategies that focused on primary prevention, things like I will put my phone away and out of reach before I start driving, or I'll turn my phone off before I start driving. And we also provided strategies that we called secondary strategies, or those strategies that really sought to mitigate risk and reduce harm. An example of those strategies were things like, I'm going to choose not to use my cell phone when I'm driving at high speeds, or I'll choose to not use my cell phone when I'm driving in dangerous weather conditions like rain or snow or ice. So we used both primary prevention strategies and secondary harm reduction strategies for participants to select from. And the results showed that participants in the brief intervention utilized both strategies, both primary and secondary strategies, to address their risky driving behaviors. We also learned that participants in the intervention group continued to utilize those strategies that they'd selected after their sessions and 3 months later. When we think about the limitations and some of the conclusions of this randomized control trial, we absolutely ran into recruitment and attrition as significant challenges for us in this study. We had an inadequate sample size, which likely led us to not be able to detect an effect. And we know that a small sample size might not be an accurate reflection of the population, so that these findings might not generalize. However, despite these limitations, we found some really useful findings as well. Specifically, participants were able to utilize strategies, both primary and secondary strategies, and they did report improvements in their attention and emotion regulation. So based on what we learned in the project, we were able to offer some recommendations and some guidance that traffic safety professionals can use to make more informed decisions about strategies to address multiple risky driving and improve traffic safety. First of all, based on the research findings that we had, traffic safety professionals may want to consider providing both primary strategies and secondary strategies that reduce harm when engaging with young adults. Primary strategies are those that we see all the time. Don't drink and drive. Wear your seatbelt. Don't drive distracted. And secondary strategies are really those that seek to reduce harm and might be more appropriate for people who are resistant to make a change or not quite ready to engage in the primary strategy that we're seeking. Secondary strategies are things like choosing to not do the behavior in certain settings, maybe when they're driving at high speeds or when they're driving in dangerous weather conditions. While we would like people to be ready and willing to engage in those primary strategies that we see all the time, there might be room to think about harm reduction and mitigation strategies and ways that we might offer more choice to people. Offering more choice might help traffic safety professionals engage with young adults, especially those who might be hesitant or might not be engaging fully in the protective behavior that we want to promote. It might be more appropriate for someone who's really in that contemplation stage of change, who isn't just quite ready to fully make that behavior change. Integrating harm reduction strategies alongside primary prevention strategies might provide opportunities to really meet people where they are and to reinforce autonomy, which for young adults is really an important developmental milestone. We also learned through this project that interventions to reduce impulsivity and traffic safety are limited. It was important really for us to understand what strategies are out there that have been used to reduce impulsivity in general, and then how could those be applied in traffic safety. And we learned that emotion regulation was identified as a potentially effective way to reduce impulsivity. Emotion regulation is really changing one's response to emotions to better their well-being. And this brief intervention that we created was focused on helping people to learn to identify and regulate their feelings in the context of risky driving behaviors. And regardless of the risky driving behavior the person was engaging in. Supporting emotion regulation amongst youth and young adults is an important skill that traffic safety professionals can think about and ways to promote. They can think about how they are leveraging existing infrastructures to integrate emotion regulation skill building. For example, emotion regulation skill building could be integrated maybe into driver's ed curriculum or into workplace training. Emotion regulation is a skill that can be taught and one that can support reduced impulsivity and can support safety. These are just a few of the recommendations that we provided in the project, but additional recommendations can also be found in the final report. And finally, I want to spend just a few minutes encouraging you to use the resource document that we created in this project for traffic safety professionals. It really takes what we learned from the development of our brief intervention and the randomized control trial, and it's intended to help traffic safety stakeholders engage with young adults in growing skills and utilizing practical strategies to reduce engagement in multiple risky driving behaviors. This resource is also going to be found on Montana Department of Transportation's website on the Traffic Safety Culture Pooled Fund webpage. So in conclusion, drivers involved in fatal crashes are often engaged in multiple risky driving behaviors, not wearing a seatbelt and speeding and driving impaired and distracted. Brief interventions designed to reduce multiple risky driving behavior have the potential to improve driving safety. And in this project, we learned a lot about not only the factors that are associated with multiple risky driving, but also based on what we learned and those underlying factors, we were able to provide some guidance and recommendations that might be useful to traffic safety professionals in thinking about being more informed in their decision-making about strategies to reduce multiple risky driving and improve traffic safety. I invite you to download those materials that we created on MDT's webpage, and I also invite you to connect with us at the Center for Health and Safety Culture. We are continually working on projects to improve health and safety, and we enjoy connecting with you in the work that you're doing. And with that, I'm going to go ahead and open the floor for conversation and questions that you've had. I've done a lot of talking. Like I mentioned in the beginning, I also have my two colleagues, Dr. Bridget Hanson and Kelly Green, who were really integral in this project, and the three of us can help to field any questions that you might have.
Carrie. I have been populating a couple links and various items and updates in the chat. Just wanted to let folks know that still an active project, so we are just in the very final stages of final edits, on the final report and resource document. So I anticipate that they should be finalized within the next week or so, and then MDT will get it posted to their website. I will send out a follow-up email to everyone attending today and let you know when those documents are available for you to access.
Thank you, Kelly.
See a couple of questions in the chat box about the text messages, and I'll pull a couple of examples of those. Carrie, if you wanted to maybe just describe them in a little bit more detail while I do that.
Yeah, absolutely. So we did use text messages because when we were thinking about a strategy that would be cost effective, could reach young adults, we know that they use their phones. And so oftentimes, well, one example of a text message in the intervention, participants chose strategies, either primary or secondary strategies that they had said that they would try and practice and use. And so some of the text messages supported that. So supported things like, have you tried that strategy? Also, like I mentioned, we focused on growing emotion regulation skills. And so the text messages then also supported that skill development in thinking about how they're, in thinking about their emotions when they're driving and what that looks like. And so really, the text messages really supported practice throughout the week when they had said that this is the strategy I'm going to try and use, then we supported that through text messages. Kelly or Bridget, would you add to that?
Yeah, I think that's great. I put just an example in the chat, and I can drop in a few more as well.
Great, thank you.
And just to add to that, so these will be documented within the final report, so you will get to see all text messages that were used for each of the different behavior modules. And I just wanted to add that these were a supplemental item that we kind of added in to remind folks about their strategy, to touch base with them again. So a lot of the content that they were getting is actually coming through the virtual session that they participated in, and then the text message was a way for us to keep them engaged and reinforce some of those skills, as Carrie was saying. And I did also see a question about how we determined the content. Specifically that the comment was about the text content, but the content of both the texts and also the content within the virtual sessions. We did a round of pilot testing with the targeted audience prior to launching any of the content within the virtual sessions. So we engaged about 20 individuals in interviews that took them, they were exposed to the content ahead of time, and then we spent time asking them about questions, getting their reactions and feedback, and then we made changes to that content based off of those comments that were given back to us. So a lot of the content was crafted around language and responses and feedback from the actual targeted audience.
Someone also asked a question about where participants were at in terms of their motivation to change driving behavior when they started the study, which is a really good question. We didn't recruit people specifically based on their desire to change their driving behavior, because of course those folks would be quite a bit different than the general population. And so some folks may not have been very motivated at all to change their behavior. Carrie, is there anything else you want to say about motivation?
No, I think thinking through a person's, so they weren't necessarily motivated to change their behavior. That I think was important, but also for those who did engage in the intervention, we also really were cognizant of allowing people to select strategies based on their motivation. So really thinking about, you didn't have to be like ready and excited and like want to change your behavior. You could also select a strategy that maybe was, a risk reduction strategy. And so that was another way that we really paid attention, in that participants could select the strategies that they were willing to participate in, that they were willing to try or give a try.
Thank you. Another question about do not disturb in focus mode on phones for distracted driving. This is off the top of my head, Linda. So definitely some people chose that strategy, to use do not disturb on their telephone while they were driving as a strategy to reduce distracted driving. Folks also chose just putting it out of reach. Giving it to a passenger was an option. If you want to see the breakdown there specifically, reach out to us and we can get you those statistics. But sort of across the board, there weren't one strategy that was chosen for each behavior more than other strategies, right? Folks really did distribute their strategy selection. And so one of our findings really is that it's important to give options so that people can choose a strategy that they think will work for them. Another great question about the virtual session, like, was it a survey? Was it one-on-one? Can we talk through that a little bit more, which I think would be helpful?
Yes, so we used that FIAS platform to deliver the content, and we had to have a person's email address. It was all done individually, so it was not in a group context. It was done individually. And then we had everyone do an assessment to get started. And based on that assessment, then their intervention was populated. So it was based on the two behaviors that they endorsed. And so each person might have a different, like I could have gotten to work on seatbelts and driving under the influence, and someone else might get distraction driving and seatbelts. So each person, their intervention was personalized to those behaviors, to the two behaviors. And then it was an interactive module that participants went through. So they had an interactive narration. It was like a little bird that would talk to the person and like describe the content for the person. So it was interactive in that way. And then there was also where the person engaged with the virtual by typing in something. Like we would ask them questions and then they would type in their response, and then we would use those individualized responses back to them in the intervention. Kelly or Bridget, what would you add?
I would add that we, again, returning to those interviews, we found that with the population that we were trying to reach, it was really important that the virtual sessions were something they could do on their own time. So rather than it being kind of one-on-one where maybe I was meeting with an individual and having to schedule that, it was something that they could do on their own time. The virtual sessions were only took about 5 to 7 minutes for folks to complete, and really allowed them to move at their own pace within kind of the time frame that we set out for them. Bridget, anything else to add?
Nope, nothing else for that. Carrie and Kelly, Ralph has a question about Montana and a specific aggressive driving statute. I'm not familiar of like a new or recent one or any changes there. I think there's probably a reckless driving law on the books, but I'm not sure anything more recent.
Nothing more recent that I am aware of. There is a reckless driving statute, and within the driving under the influence module and the seatbelt module, as well as the distracted driving module, we mention state-specific statutes or local ordinances as a way to kind of re-educate the individual going through the intervention about the laws that currently exist. Aggressive driving, though, is not one that we had an identified specific statute that we kind of called out as far as a piece of the content. So I'm not aware of anything, Ralph.
Just to add to that, what Kelly said in identifying Montana-specific information, we did that with risk perceptions as well, where available. So like, thinking about perceptions, like, most college students, we definitely would say things like, most college students your age are not driving impaired, or, if we had that data that was specific, we definitely use that in the intervention as well.
Thanks, Carrie, and that's a good connection to the next question, which asks about people's beliefs about what others are doing. So their normative beliefs, for example, to what extent do they believe that everybody speeds? And so we did ask normative belief questions for every behavior at pre, post, and follow-up, asking folks about how often they thought most drivers their age engaged in those behaviors. And so we didn't see any changes or differences between our control and intervention in our outcome data. But again, we were able to incorporate that for feedback to correct some of those normative beliefs when they were perhaps inaccurate. And then a really nice question about whether we're going to try this again. And if so, how will you modify your strategies for recruitment and retainment?
I would love to try this again. We do not have a project ready to go to do that again, but I absolutely would love to. It is, when I think about our first cohort and looking at recruitment and retention, I think multiple things went into it. We were, I think, surprised by I mean, we really had to think through how do we incentivize participants. And we did ask in our interviews when we did pilot testing, like what would that look like? What would you need to continue to engage with us? And we did make some modifications, but I think after even that first cohort, we realized we really did have to increase the incentive amount to get people to participate with us. We had to incentivize more often to say like, hey, you don't have to wait to the end, like you're getting it as you go. And I would definitely be looking to think about, you know, what other strategies are out there that we could use to retain participants in this in the study, because it was a longer term study. I mean, we wanted them at we wanted them at post intervention, and then we wanted them again 3 months later to really see how things were working.
I would add, I think we learned that the original size of the group that we reached out to, so Carrie mentioned that we did direct email advertising recruitment, and with that second cohort, we had reached out to over 8,000 individuals. So that is, and from that number where we ended up, so I think one of the things that we learned is that original recruitment has to be even larger than that. So that was definitely something we learned through cohort 1. We started with a much smaller group that we originally reached out to. And so in cohort 2, we expanded that dramatically. And so that would be another thing if we were to do this again, that initial group that we reach out to has to be quite large.
Yeah, and I think maybe in case it wasn't clear, those were college student lists, right, that we were able to get from partnering universities. And so all of the participants were college students in Montana, not always from MSU, but the direct email list came from being able to reach out directly to email addresses that we received from institutions. I think it could perhaps be interesting to do like employers or some other sort of group, but I do think that that direct connection and ability to recruit, exactly, somebody who has a relationship to the folks, to make that connection even a little bit tighter would be helpful. And then a question about if we got any information from participants about reasons why they engaged in a risky driving behavior or why they might want to change that behavior. And so I'll just start by saying we really focused on whether we'd be able to change those driving behaviors. There's a lot of information in the literature about correlates and factors and reasons for engaging in risky driving behaviors. And so we didn't collect specific information from each individual about their reasons. And again, their sort of willingness or interest in changing that behavior wasn't an inclusion criteria. We were trying to get folks who engaged in those behaviors, even if they weren't necessarily initially all that interested in changing that behavior, and then determine to the extent to which we could feasibly deliver an intervention and then any impact that would have on those outcomes of interest. At least to my eye, that looks like all of the questions.
Great, thank you, Bridget. Thanks, Kelly. Thank you all for joining us today. Please keep this conversation going. Reach out to us at the Center for Health and Safety Culture. Please get on MDT's website here in the next, hopefully, week or two, where we have all of these resources posted. And thank you for taking the time to be with us today. Have a great afternoon.